Hello, my name is Dr. Manish Gupta. I am Senior Consultant Neurologist in jaypee Hospital. Today I am discussing about a disease which is not very common but still present in older people mainly, which is we call it as Alzheimer disease. It is the most common form of dementia and which is seen in the older people. It's actually a disease in which patients having difficulty in carrying out the daily activities, and normally it begins very slowly and it starts mostly at the age of 60 years, and as the age increases the risk of Alzheimer disease increases. Now the symptoms of Alzheimer disease which you should know so that you can diagnose or so that you can have an idea that maybe patient is having some dementia. So this disease starts very slowly and starts mainly involves the thoughts, memory and language. Initially patient will have mainly trouble in remembering the recent activities, like he may forget what has happened just immediately, maybe 1 minute or 2 minutes back. And then slowly patient can have difficulty in naming the family members or the close ones. Then this Alzheimer disease have stages. Initially what we call as MCI, and it's called a minimum cognitive impairment disease. Initially we separate the mild memory complaints into this bracket, and not all patients of MCI convert into Alzheimer disease, but most of them. So the Alzheimer disease, as the stages grows of Alzheimer disease, it involves the involvement of what we call a visual-spatial disorientation also. In visual-spatial disorientation, mainly the patient will have difficulty to find the way, maybe initially outside and then in the surroundings also. And then the patient will have starting difficulty in naming of the family members also, and those person to whom they know very well. And after that, as this disease progresses, patients started having complaint like the behavioral changes, like in the form of they will be more anxious, more aggressive. Sometimes they have a wandering behavior. They will go out of the home, and then in the later stages they will not have any. They will forget how to brush, how to comb, how to wear the clothes, and they will not ask for any food also. That is the late stage. And because of this, the main stress comes, or the main burden of the stress comes to the caregiver. So as you know that this coming 21st September is a World Alzheimer's Day, I would just want to say that Alzheimer disease is a progressive disease involving the older people, and the only thing that you can do is for prevention is to do regular exercises and have a normal diet and normal sleep. And whatever symptoms which I have just told you in this video, if you find anybody who is having these symptoms, it's better to refer to a specialist for the same, so that we can treat as early as possible and to minimize the problem of that patient. Thank you.